Greetings. Let us learn about the role of ultrasound in patients with cirrhosis and portal hypertension. And these are my acknowledgements. Please take time to read this notice. So, let us learn the pathology of cirrhosis. What happens in the liver? So, the liver lobular architecture gets distorted, fibrosis sets in. There will be bridging fibrosis from portal triad to portal triad to central vein, and then resulting in regenerative nodule formation. In the process, the liver gets shrunken. The normal sharp edge of the liver becomes blunted, and the liver develops a nodular appearance. As with fibrosis, the sinusoidal flow from portal vein to central vein gets disturbed, and with that resistance, and then due to secondary development of hyperdynamic circulation, portal hypertension results. So, what are the findings of portal hypertension in cirrhosis? So, the portal flow does not show the normal centripetal flow. It flows away from the liver. The portal vein size may increase, and as the portal hypertension becomes significant, the blood should take a path back to the heart via the portosystemic collaterals, typically seen as varices in the esophagus and stomach. As portal hypertension develops, the pressure in the splenic vein increases. As the pressure in the splenic vein increases, the spleen becomes larger, or splenomegaly. And finally, with portal hypertension, hyperdynamic circulation, result and also decrease in extracellular volume, activation of renin-angiotensin system, salt and water retention results in ascites. So this is the pathology of cirrhosis. And if you keep this thing in mind, then it's very easy to find, to list out the findings of cirrhosis on imaging studies. But before we go there, let us review the basic pathology at the lobule level, where you will see inflammation, which you will find out by checking liver enzymes. Hepatocyte injury results in elevation of AST and ALT. Bile duct epithelial injury results in elevation of alkaline phosphatase. And as things get worse, bilirubin gets elevated. With continued inflammation, myofibroblasts get and stellate cells get activated, resulting in fibrosis. This is typically assessed by doing a liver biopsy, which shows the characteristics of cirrhosis under the microscope. With ongoing portal hypertension, portosystemic collaterals, endoscopy will show varices. This is the path we have been following, but you could also assess this by a different route. That is fibrosis assessment by looking at blood test markers to calculate the FIB4 score based on patient's age, AST, ALT levels, and platelet count, or measuring the liver stiffness, which is an indirect marker of the amount of fibrosis by using FibroScan, or checking portal hypertension by looking at features of hypersplenism, especially looking at the platelet count or looking at the portal hypertension findings with an ultrasound. So, so when you see a patient with cirrhosis, suspected cirrhosis, based on clinical findings, and then looking at labs that have been abnormal for a long time, clinical findings of palmar erythema, white nails, spider angioma, parotid enlargement, gynecomastia, caput medusae, testicular atrophy, shrunken liver, enlarged spleen, maybe free fluid, muscle wasting. You should send the patient for ultrasound. When the patient goes to the ultrasound, what does the ultrasonographer tell us? So, when you have a patient with cirrhosis and you perform an ultrasound, this is what you will notice. You have a series of findings. On ultrasound, the liver may appear nodular, and sometimes the edge that is sharp can be rounded. There will be changes in the portal flow. The normal flow towards the liver could be reversed. The size of the portal vein can be larger, and you may see collaterals uh, in the abdomen. The spleen size will be increased, and you may see free fluid. So these are all the things you have to be thinking about when you are looking at an ultrasound report. Basically, what you've learned in pathology, and that's the same thing will be seen by the ultrasonographer. So I thank the authors of this beautiful review and hope this is helpful. Thank you.